It was another high-pressure moment for President Obama.
Madam Speaker,
the President of the United States.
He has lived on the political high wire, it seems, from the campaign through the financial crisis and the stimulus battle, and now health care.
I'm not the first president to take up this cause, but I am determined to be the last.
Yes, there were ghosts in that chamber tonight, the other presidents who tried to reform the American health care system and failed. From Teddy Roosevelt to Harry Truman to Bill Clinton, who came to Congress 16 years ago this month with his plan.
There's still a lot of people who say it would be an outright miracle if we passed health care reform. But my fellow Americans, in a time of change, you have to have miracles. And miracles do happen.
Not that year. That year, Clinton and the Democrats got hammered politically. This time, President Obama declared will be different because, he argued, it has to be.
Our collective failure to meet this challenge, year after year, decade after decade, has led us to the breaking point.
So the stakes were high again, and the Congress President Obama addressed was bitterly divided again. Not just the Republicans, his own party. He had his work cut out for him, and he went at it with relish.
We know we must reform this system. The question is how.
First, the problem. The president sought to remind Americans of what they dislike, even fear the most in the system, by offering emotional examples of all too familiar healthcare nightmares.
It happens every day. One man from Illinois lost his coverage in the middle of chemotherapy because his insurer found that he hadn't reported gallstones that he didn't even know about. They delayed his treatment, and he died because of it. That is heartbreaking, it is wrong, and no one should be treated that way in the United States of America.
But how to fix the system? That is the question that's bedeviled so many presidents, and that has ignited the divisive battle that's raged in Congress, in the media, on the internet, and in town hall meetings across the country.
The time for bickering is over. The time for games has passed. Now is the season for action. Now is when we must bring the best ideas of both parties together and show the American people that we can still do what we were sent here to do. Now is the time to deliver on health care.
This was not some safe, predictable health care policy speech. President Obama was going all in rhetorically, and the atmosphere thickened. It exploded when he tried to answer the most inflammatory charges against his plan, like that idea of death panels that would deny care to the old and sick.
Now, such a charge would be laughable if it weren't so cynical and irresponsible.
And then he tried to answer another accusation, and listen to what happened.
There are also those who claim that our reform efforts would ensure illegal immigrants. This, too, is false. The reforms I'm proposing would not apply to those who are here illegally.
That was Republican Congressman Joe Wilson shouting, "You lie," at the president, a rarely used word in the House chamber, explicitly prohibited by the rules. He later apologized. The president simply moved on.
It's not true.
Focusing on his message, trying to take the high road, leaving Wilson and others behind.
If you come to me with a serious set of proposals, I will be there to listen. My door is always open. But know this, I will not waste time with those who have made the calculation that it's better politics to kill this plan than to improve it.
The plan itself, the president claimed, will deliver what polls show Americans want: stability and security in health care, the end of those nightmares.
Under this plan, it will be against the law for insurance companies to deny you coverage because of a pre-existing condition. As soon as I sign this bill, it will be against the law for insurance companies to drop your coverage when you get sick or water it down when you need it the most.
The president also called for a mandate that all Americans have health insurance, a new insurance exchange where small businesses and individuals could buy low-cost coverage, and most controversially, a so-called public option, a government insurance program.
It could provide a good deal for consumers. It would also keep pressure on private insurers to keep their policies affordable and treat their customers better.
There was another ghost in that chamber tonight, the spirit of Senator Ted Kennedy, who fought for decades for universal care. And with his family watching from the gallery, President Obama invoked his legacy and read from a letter Kennedy wrote him in May.
What we face, he wrote, is above all a moral issue. At stake are not just the details of policy, but fundamental principles of social justice and the character of our country.
And at the end, President Obama sought to draw on the grand rhetorical tradition of President Kennedy and others, trying to summon the country to a great and necessary endeavor.
We did not come to fear the future. We came here to shape it. I still believe we can act, even when it's hard.